Folks, thanks for coming on with us today. My name's John Dubas with Premier Marketing. We'll be spending the next 45 minutes to an hour or so discussing the marketing of 5-star Medicare Advantage plans. These are programs that aren't all that widely spread across the country, but they are programs that are among the best of their genre, and they are also endowed with a special election period that allows a one-time switch to these plans throughout the course of the year. So they're very pertinent to our discussion. We're trying to identify different niches in the market that might be helpful for you, that coincide with your marketing agenda to make you a more prolific seller in the realm of Medicare Advantage programs. Today's program is being recorded, and it, along with much of the material that we'll reference throughout the course of the presentation, will be sent to all those who have RSVP'd to today's presentation. You'll notice in the GoToWebinar software that there is an area for questions. We'd ask that you use that section with any questions that you have. Many times the questions are answered through the course of the presentation. We will make certain at the end that we address all of those that are entered into the software. A bit of background about Premier Marketing if you're not familiar with us. We are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, offering insurance products through independent insurance agents such as yourself to the buying public. And we do so through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we recently celebrated a milestone in our history, our 50th anniversary, which is quite an achievement for an organization that started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in the Medicare and ancillary space. We do so through a full insurance portfolio that includes Medicare programs such as Medicare Advantage, Medicare Supplement, and standalone Part D prescription drug plans. But we also offer a full life insurance and annuity portfolio that includes final expense life insurance, pre-need, long and short-term care programs, disability income, and ancillary benefits that include dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers that make you competitive in your market. And that same philosophy carries over into the prescription drug plan space, where those national carriers are available to you through our organization. Our Medicare Supplement portfolio is very large and robust and has a number of tools specifically set up for you at no cost that help you be successful in this space as well. When you speak of the ancillary products in each of those categories, you have the name brands available to you, the national leaders in each of those categories. When we look at the Medicare market specifically, if we're examining how we best approach this and what we approach in this large market, we see a space that is a burgeoning market. You don't come on a program like this without someone telling you about the silver tsunami, the baby boomers aging in at 10,000 people a day, one every 10 seconds. But if you look at the Medicare market just based on age, you're not looking at really a complete number, because a number of those folks that do turn 65 may not access their Medicare benefits immediately upon turning 65. And there is a large section of the Medicare market that you're missing, and that's the medically disabled folks, the folks that are qualifying for Medicare based on a disability. And this is a space that's about 1/6 of the Medicare market. So it's something we really need to consider as we approach marketing programs, because it is an opportunity to help folks that have a diverse background, in a manner of speaking. The folks that are on Medicare, on average, well, 2/3 of them have 3+ chronic conditions, and a number of the others, half of them, have some challenges with their income and their assets. So some of the things that we offer through a diverse portfolio of products helps those folks deal with both their health conditions and the challenges they may have in paying for those services as well. So it's a diverse audience. It's a diverse market that we're looking to get into. And for those of you who are looking to offer, finger quotes working, the best, this is one way to do it. When folks reach Medicare eligibility, they have a number of options available to them. The first of which is, what do they do with Medicare itself? Do they pick up the optional Medicare Part B programs, which most of them do? And then do they look for help with their prescription drugs? Most of them do as well. They can do so through a standalone Part D program that will help them with one of the choices that they have when it comes to covering some of the gaps in the medical coverage by picking up a standardized, modernized Medicare supplement, a Medigap policy, or they can go into a Medicare Part C program that many times integrates in the medication coverage into the overall program. So folks have an opportunity with a number of different choices, and they then also have an opportunity to decide what all they need to do, if anything, in addition to those coverages. Because what we're seeing when people come into Medicare, at whatever age is their first time into Medicare, you're seeing almost an even split in the choices between Medicare Advantage and Medicare supplement programs, with a portion of the population seemingly doing nothing. That may not be an absolute truth, since many of those folks may have retirement coverage or coverage through the VA or coverage through another means of covering those expenses such as Medicaid or whatever. Or there might be a portion of that, scratch the might, there is a portion of that that is choosing to self-insure. So there's a number of things we have to make available to them, and that primarily goes into education, because these people have a difference in what folks that are on Medicare have choices, and that is sometimes influenced by whether or not they are accessing Medicare through the normal means of aging into it, or if they are doing so because of medical disability. In each of those circumstances, it gives what we have to offer gives them an opportunity to take advantage of programs that can best suit their situation. And when you look at the population under 65, in most states, the only option they have with Medicare supplement programs is a Plan A, and sometimes that doesn't look like much of an option at all. We also make available to you a way to help you speak the language of Medicare. These tools here are actually acronym definition sheets that many times are helpful for you in the course of study or in the course of researching what you need to do for your prospects and clients. If you like one of these, please let me know in response to the email follow-up that we'll send to you, because that follow-up will include the presentation and the recording, but as I mentioned, also a number of those other pieces that we're going to reference in just a bit. This is a very large particular tool, and to receive it requires a second email. So I don't normally send it with just the regular follow-up. When we look at the 5-star Medicare Advantage programs, one of the things that we're looking to do is help you with your insurance practice in a fashion that gives you another revenue stream, helps you reach into the population with strong programs that can help you also minimize the customer service portion of what you do as part of your day. But we also want to make certain that we're looking at a number of different possibilities. And whether or not you are familiar with working the Medicare niche market with special needs programs or different SEP opportunities, or looking at different ways of helping people with their coverages, it's important to note that even though we might feel handicapped to a degree, there are tools out there that can help you be very proficient in what you do. One of the first things we need to do, however, is make certain that we understand the Medicare star rating system, which predicates someone having a 5-star program available. Well, we have to know what the rating comes into play. These are actually a rating system that helps Medicare Advantage and Part D programs be evaluated for how well they perform in several categories. And this includes the quality of care and customer service, which is a big piece of what we do as well. The ratings will range from 1 to 5 stars, with 5 being the highest and 1 being the lowest. The plans that are rated, they're rated in each individual category, and then Medicare also assigns plans 1 overall star rating to summarize the plan's performance as well. You will occasionally see carriers that get a 5-star in one of the categories speak to that, but what we're referring to is the overall 5-star rating, which is a little more difficult to come about and obtain. These plan ratings may change from plan year to year, and they include evaluations in 5 different categories. They speak to how the plan helps an individual stay healthy through screenings, tests, and vaccines. They also look at managing chronic long-term conditions. They look at how responsive and how care is delivered by the plan. They also look at how the plan deals with member complaints, problems getting service, and those choosing to leave the plan. And they also look at health plan customer service. So there's a number of different categories that come into play, and a 5-star rating is deemed because how well plans perform in each of those categories. These categories also then help a plan with an overall 5-star rating obtain a special election period for the year that they have that rating. Generally, that can only happen once during a specific time during a year. And these special enrollment periods that you might be aware of in other circumstances are times during the normal, outside of the normal enrollment periods, that an individual can switch their program. So if a plan individual wants to enroll or change plans, they can take advantage of the step to join or switch to a 5-star Medicare Advantage or Part D plan. That means the individual can enroll in that Medicare Advantage plan or standalone Part D plan that has an overall plan performance rating of 5 stars. So if you got a plan that just has it in one of those categories, the SEP doesn't apply. The SEP is available for use only once during a calendar year, and it begins right after the open enrollment period, the AEP period, on December 8th, and lasts until December 30th of the plan in which the enrollment period is coming about. These enrollments in December are effective January 1st, and the enrollments that occur in each of the months from January to November are effective the month following the enrollment request. We also need to make certain that we realize that to enroll in a Medicare Advantage plan, regardless of its star rating, there are certain categories, these categories, that an individual has to qualify for and satisfy. They have to be entitled to the Medicare Part A and be enrolled in Medicare Part B. They've got to live and reside in that service area where the plan is offered, and they can't have end-stage renal disease at the time of enrollment here in 2020. There are some exceptions. If a plan is a chronic special needs program that is set up to service the ESRD community, that would be an opportunity to use this program or this SEP. Why you would want to in this circumstance, well, they may not be able to change for another reason. So let's look at some of these things that we look at here and how many people are actually in the different programs based on star ratings. We have seen over the last couple of years the overall star ratings of Medicare Advantage plans. Well, the companies are really investing in that. We're going to put it that way, because over 80% of the population has a plan that's 4-star rated or above. However, we can see that the biggest push into a 5-star rating occurred in 2018 and in 2020, where 10% of the population was in a 5-star rated plan. That is influenced, of course, very much so by the number of plans in a particular market that has a 5-star rating. So the availability of the plan obviously has a great influence as to how many people can be in one. These are listings of programs that have 5-star ratings. What we have on the left-hand side is actually the CMS document that lays all this out. The plans that are listed on the right are from an article that you'll receive also as part of the follow-up that gives you an idea of these plans and where, what company offers them. For example, here's a 5-star plan offered by a carrier, Cigna actually, that is available in the Alabama and North Florida markets, and it gives you a breakdown of products like this. I'm using this as an example simply because if you're looking to market 5-star plans, and we have helped you through the system in making certain that you know where those plans are, that they're in your target market, what you look to do with them, it's very important to be in touch with the agent managers of the carriers in that market, particularly the one that you're looking to offer, to make certain that you have all the other details that can make a difference as to whether or not someone would want to enroll in the plan. For example, network. How does that affect enrollment? And then, of course, the cost out of pocket for these programs as well, including the maximum out of pocket, the different co-pays for different services, and the extras that are available on those programs. What we have here is a full-blown presentation from United Healthcare utilizing Texas programs as a sample of these Medicare Advantage opportunities and where they happen to be. Texas is a kind of a unique state in the fact that it's got 254 counties, and a lot of them fall in a 5-star rating for United Healthcare this year. I'm going to roll through this really quickly for you to make certain that you understand how important it is to be in touch with your carrier representatives that have full details on these plans. We do too, obviously. This particular presentation is going to come to you with some of the specifics of it, obviously very evident in the presentation, but there are certain things that we're limited in, and that comes into some of the different areas as to how some of these over-the-counter benefits may be offered in particular areas, how transportation may come into play, or whatever these ancillary benefits are as well. But most importantly, how the networks work versus the rest of the market. I mean, I have a listing of the market providers, but that may not be the total answer to you in a particular area where some carriers may have a larger network that comes into play, and that might be a difference in a person selecting even a lower rated star plan in its general intent because of the way that that network can treat what they're dealing with. So when we look at this, we're going to look at how the plans are measured and earned. We're going to look at the components of the SEP itself, the resources this carrier, in this case United Healthcare, has with its toolkit marketing highlights, and how you can work to help preserve a 5-star rating. Why would you care? Well, you have an opportunity to sell this all year round. If we do things properly, we can help extend the life of that rating as well, and it gives us an idea as to what we can do to help other carriers that may be part of our portfolio as well. So when we look at this, United Healthcare focuses on 3 key areas. They look at the clinical aspect, where they're looking to drive better health through effective care and clinical quality. You'll also look at the way the plans operate and how they then perform to appease different requirements that help them keep that rating, such as keeping the appeals very timely and fair and work in a means that generates lower complaints. And they also look at how the service of these organizations, in this case United Healthcare, delivers the service that helps improve member satisfaction. And part of what we use in this, as we do in many of the other presentations that we offer, particularly the SNP presentations. It's how we determine where these plans are in a particular market. You'll notice when I visited the plans and showed the ones that have a 5-star rating, it didn't say where those plans were. Now, did they? The link to that through the CMS link will help you with this, but this will give you detail regardless of just having the knowledge that a plan exists in your particular area. Using Medicare.gov gives us an idea, and it'll lay out in those diagnoses the star rating. We'll see in this particular circumstance, wherever this was pulled from, we have a 3.5-star rating. Obviously, that's not a 5-star plan that we're looking for. What we have in these different circumstances is through the Medicare.gov website, we see that these programs have a designation that tells us that these plans have a 5-star rating. And you'll notice that little star that comes after the star, that only shows up on plans that have the 5-star rating. So it gives us an idea of what programs are available to us and what the plan details are thereafter. It also gives us an idea as to what chassis these plans are set up on. In this particular circumstance, we see that all 3 of these programs are set up on an HMO point-of-sale chassis. What you'll notice in many of these evaluations, and particularly if we went back to the program that listed all the programs that have a 5-star rating, a lot of it will deal with a stricter network in many circumstances, or a network where the providers are actually employees of that plan. In those circumstances, it's much easier for the plans to dictate certain procedures that the providers should follow that would drive up that star rating. Big things on standard things like flu shots, pneumonia shots. A topic of great interest to myself at this time, shingle shots. The different things that come into play. Boy, you deal with shingles, guys. What a pain, literally. You can also then find out additional information on the SEP, because this is a piece taken from the UHC guide to enrollments. It gives you ideas as to what specifically can be done for an individual with a 5-star program within United Healthcare system. Some of the things that come into play here, well, the higher star ratings also bring the carrier higher funding. That's part of what enables them to keep delivering a good selection of benefits. And it also gives us the opportunity then for that additional benefits to help us sell year-round with that 5-star rating and the plans that bring that to the market. So when we look at it, we're looking at folks that once again are living in a service area that where the plan is approved to operate. They don't have end-stage renal disease. They have the opportunity to enroll in that 5-star plan, and it goes from that time period when AEP ends to the end of November. And folks will look at these programs in many circumstances because they become unhappy with their current program or the plan's not meeting their current needs. And it may be a circumstance where an original Medicare beneficiary did not choose the plan with as much homework put into it or information delivered to them as they needed to make a proper choice. So this particular presentation actually goes into the detail and will give you the eligibles for the state, how many are estimated to be DSNP eligible, what the year-to-year growth was, what the penetration into the market is, and what the United Healthcare market share is. Excuse me. Why is this valuable? Well, because it helps us determine if our target market gives us the opportunity to really pursue this type of business, and if not, what other type of business would be available with some of the other steps that we'll look at that give us an opportunity to look through this. So it'll go through in each of the different markets that same sort of material. Where here we're looking at Corpus Christi with details into the plans. It gives us also the Medicaregov analysis of the plan in the market. It speaks also to the dual programs that are available in the area, and it'll go through different pieces of the state as well. Here we're looking at the Dallas-Fort Worth Metroplex and the plans that are available there. Specifics about the program, the dual program once again. Going into East Texas, looking at the program specifically there. Down in the San Antonio, dual plans there also. East Texas again. We looked at the 5-star plan for that with specifics. San Antonio, it looks like I duplicated some slides here. My apologies. And where do you find these individuals? Well, first off, remember Alice in Wonderland falling in the hole and looking at the Cheshire Cat and asking which way to go. Well, if you don't know where you're headed, it doesn't really matter. So we need to start with a plan. And much of the same things that help us in other areas also help us with the 5-star program. Working up an Aep Pipeline to prepare for these folks. We get them in the biggest or best suited plans to begin with. It's going to help our retention and our persistency. Many of the different things we do in local area marketing help us with this as well, and that includes community meetings, working with providers, the retail venues. Right now there's a selection process going on for the Walmarts, and there'll be some additional information coming to you as well on that very quickly. Some has already gone out for folks that were using the program successfully last year. Here you can reach into the pharmacies to also find out if folks have some challenges with certain plans, the different community events that come about, and then of course enrollment centers that you can establish if you have an outside office or working with many of the health plans. They give you that opportunity as well. United Healthcare is very good about that. Some of those different resources that are available to the programs, you'll find these with most of the major carriers, where their agent support kit will give you the opportunity with pre-approved propaganda, in a manner of speaking, pre-approved marketing material that gives you the opportunity to put in your information and market to that specific population. If a person doesn't really point well to a 5-star plan, first you got to wonder why, but secondly, it still gives you an individual to talk with and discuss their situation, and if nothing else, to put into your pipeline for later. United's got a ton of material available to you, most of it available without cost. Visiting with your assigned agent manager can really help in determining a marketing plan that's good from now through the end of the year and renews into 2021 already as well, with much of the material they have available. What we have as an end result is better care for our prospects and clients, better health income outcomes for them as well, and an overall better experience. Some of the different things that can make a difference for you as well with this company and others as well is speak to some of the extras. It's interesting to see how some of the stuff, because it might have been in the program year over year, we forget to talk about it with the enthusiasm that we did when it first came out. One of the things that you see in United Healthcare programs is they do talk about their annual wellness visits, the house calls that are available to them, different memory rewards that come as part of the system. But it's interesting to note, too, that the different hearing programs that United has invested in a great deal aren't really spoken to as much, even in some of their own material as well. So it helps us to be aware of the network that comes into play and the extras that's part of that system. Some of the things that we can do as well to get in front of individuals, the cold calls, obviously that doesn't apply if you're looking directly for Medicare Advantage or PDP programs, but there are some of the extra programs that might be, of course, a piece of the satisfaction of a member, and pursuing that type of business can help put you in front of a person that's evaluating their entire health program. What I'm talking about in many circumstances here are the dental, vision, and hearing programs, because visiting with folks about helping in those specific areas can point you to folks that, well, you might get a standalone sale in that area as well, but it might give you the opportunity to visit with folks in a market that has a 5-star plan as you satisfy the needs that are initially brought about to talk about the original appointment. And then, of course, the different community-based programs are very helpful, and that includes the retail marketing plans I visited with about just a little bit ago, the Walmart programs, the different retail programs that are offered by different carriers. United offers their own plan outside of Walmart to get into retail as well. Working with other centers of influence, too, that help you get in touch with folks that may not respond to other marketing outreach, and that includes like faith-based organizations, nutritional sites, senior centers, different senior living facilities, different centers of influence that will help you spread your gospel of the different plans you have available. Because you are an independent agent, that gives you the opportunity to use generic material in many circumstances, which helps you obtain the different appointments in these places as well. It also gives you an opportunity for a regular delivery of this message. So you're in those communities on a regular basis. They begin to recognize you, you build trust, and you become the subject matter expert in your community. We speak a lot about the different programs that we have available, but we also, in certain circumstances, sometimes forget to utilize the providers that deliver the care for that particular product as part of our overall marketing system. And by offering our skill set to these individuals, we're actually making their life easier as well. So don't forget to market to the doctors, the specialists, but also deliverers of care like dentists or folks that are in a network and that are delivering durable medical equipment to different members as well. They make a big difference. Different carriers also offer different programs that help you. During different times of the year, they may have lead programs that come about, and by creating that atmosphere of trust and that coexistence in a market, you are making yourself very visible to those agent managers that control a lot of that lead flow. They're the ones with United that control the retail marketing, but they are also then the one that will help set you up with opportunities all year round, and that works into a 5-star mentality. Those community activities you're seeing in the last couple of years, CMS really back off of some of the hardcore oversight that they had with these, but these refer to more of like health fairs and things of this nature that can really help you get in front of the community as well. There are door knocking opportunities, not in the Medicare Advantage or the PDP space, but these are then demand products that help get you in front of the community as well, hence the need for that full portfolio. And we're seeing a lot of folks really take advantage of social media. Facebook particularly, our target market is a big portion of the folks that use that particular social media tool. And we're seeing some great results on some of our social media campaigns as well. And we still deliver direct mail discounts based on productivity. We also deliver the electronic tools that make you the professional in this space. So if you're dealing with someone who is a 5-star, possible 5-star member, this gives you the opportunity to enroll them electronically, very quickly, compliantly, cleanly, and it establishes a reputation that you have that will help you garner referrals as well. This particular program is set up with a lot of help for Medicare supplement programs, but it also delivers for you an opportunity to cross-sell. So if you have an individual who is comfortable with their plan, but need some help with the hospital co-payments, utilizing this program can help you fill that gap. By selecting that Medicare Advantage program, it allows you then to select perhaps a hospital indemnity plan from a number of different carriers that are available with that program in that market, and can help you in a cross-sell situation as well. It also allows you to collect the scope of appointment electronically and store it electronically for that mandated 10-year period as well. So a number of different things that can come into play here by utilizing a tool that can help you not only cross-sell, but do so compliantly. Because it'll help you also right through the application process. So you found an individual that only has a 4.5-star plan, and they can't change now. They don't qualify for any other SEP, but they do qualify for a hospital indemnity program, and they're looking to fill that gap. You can also utilize this tool then to electronically apply for that coverage. So it's a nice way to use a program available to our contracted agents without cost right through that system with the e-scope as well. This particular program, the Medicare Center program, enables you then to reach out to those folks in the Medicare Advantage and PDP space and get them the information they need to do research, should they choose to do so, and be comfortable with the entire sales process, and in many times don't require a face-to-face meeting at all. You send out the information compliantly, you've obtained the scope of appointment, and the application process is very simple and electronically held right through this program. Some additional things that we can do for you, as I mentioned, having a portfolio of products is very helpful. Many of the companies will have an electronic contracting process that can speed things up for you, but then having some of the ancillary products electronically contracted through this system can help you as well. This gives you the opportunity to build an agent portfolio on yourself, detail all the information that you need to contract with any of the companies across the board, and gives you then the opportunity then to electronically contract with those folks and make the entire process much simpler for you. As an independent agent, you probably have a spread of products with different marketing hierarchies. The challenge you might have with some of that sometimes is making certain that you're protecting your business and your license. This is a discounted errors and admissions program that enables you to purchase coverage that will cover you regardless of the product and the upline that you're utilizing for that product. It helps you protect yourself as well. This also gives you an opportunity to make certain that your insurance license stays into play through bundled continuing education credits that we have through our relationship with WebCE. This helps you do some things much more economically and simply and keep that license in place. If you are also recruiting, and in certain circumstances you run across folks that aren't licensed yet, this is a way to help them get their license on a discounted basis that also enables you to grow an agency. And this is a way also for you to gain modified guarantee issue non-cancelable BI coverage on yourself, helping you maintain your own benefit structure as an independent agent. Yeah, it's part of what you need to do. A great way for you to get this at discounted rates where you share in the commission as well. Much as where today's presentation is being recorded, we do so with a number of other topics, and they are posted on our website at premiersmi.com and on our YouTube channel as well. So you can go in and look at different programs in the past, do so anytime, 24/7. It gives you also the opportunity to make certain that there are certain areas of focus that you cover them all on a timely basis. We can only do so many webinars during a month, and we try to vary them so you don't always have an opportunity to see the same webinar month over month. This will help you with both product and marketing techniques as well. Many of the carriers that you become involved with will also offer different incentives to help you work with them and give you an opportunity to see what you fully make on certain products. With Medicare Advantage and PDP programs, this doesn't apply since the compensation package is set by CMS, but all these other programs that you're looking at to help solidify the plans that you put into place, dental, vision, hearing programs, hospital indemnity, cancer, stroke, heart attack plans, they then can be part of a tracking system through our website that can help you make certain that you are taking advantage and getting all of what you deserve as part of your selling process. This was our planned premier trip this year, last month. That was a trip from Miami to the Bahamas. With a lot of what's going on now, it's causing us to make certain that we reevaluate how we can take care of the folks that qualified for this trip that didn't happen and what's going to happen in the future. So watch for some of those as well. Some additional things that we can make available to you are contact lists that are butted up against do not call, ordered within the parameters of different parts of your target market. This then gives you the opportunity to smile and dial for certain programs. Once again, you can't do that for MA or PDP, but you sure could for final expense, dental programs, other plans that come into play, med subs. We do also offer the different training programs on those community-based programs that I referenced before as well. Help set you up with those generated prospects from the carriers, look through the specifics on those internet leads, and that direct mail system with writing consistently with our organization. It will have the cost of your direct mail program. What we're looking for is an opportunity to work with you in these different areas. And if you're interested specifically in the 5-star programs that are in many of the markets, we want to make certain that you're working in an area that, well, to quote an old comedian, go to where the food is. If you're looking to market a 5-star plan where there isn't one, we got a challenge. The next county over, there might be one depending upon where you are. You know, in Texas, they're all over. But it gives you the opportunity to set it up and make it part of your overall business, because people see the return. They don't always realize what it takes to get set up in these programs as well. And we want to make certain that we help you with that portion of the program. Because if you determine it's a crucial part of what you want to do as part of your marketing plan, or if you're an individual that wants to just simply make certain that you're aware of details about the program so you don't lose out on some of your regular prospects that you're running across, we need to make certain that we've got you the details on these plans specifically for your market, and that you prepare to move forward with those programs as part of your overall marketing initiatives. You can reach any of us here at Premier in order to get those details as well through our toll-free number at 1-800-365-8208, or visit us on our website at premiersmi.com. We'll help make certain that these plans are part of your overall marketing initiative. It will give you a leg up on your competition when it comes to the quality of plans, obviously, but it also helps you with your retention and the persistency of year-over-year enrollment, simply because the folks that go into these programs tend to be much happier than some of the rest, and it's a great way to stick with the folks that come into your book of business. They stay there, and then, of course, we look on growing that book year over year instead of just fighting to stay afloat. All that said and done, we realize that you have a limited amount of time in many circumstances to do what you need to do. We want to make certain that we help you with closing that window of time with these 5-star programs. So visit with us in order so we can help you set up an overall initiative for your marketing of your agency moving forward. We want to thank you for coming on the line with us today to learn a little bit more about 5-star plans and some of the specifics that they have. But we also want to make certain that we act as your back office to help create your overall program. So give us a call, 1-800-365-8208, and let's visit about how we can make this a part of your overall marketing initiative. That said, in the meantime, we look forward to that discussion, and we wish you good selling. Thanks so much, and we'll talk to you soon.